pain serves as a warning of things we're better off avoiding. Thorns, hot objects, poisons, disease, situations that might cause us to be injured.
Okay, so the fact that it feels so bad is a good thing.
Right.
What is the mechanism behind the sensation we call pain? Pain involves a complex series of processes that researchers are still working to fully understand. To begin to understand pain, let's consider these three basic steps. The body sends pain signals to the brain interprets these signals, the brain sends information about pain back down to the body. Pain receptors are different from receptors that sense normal touch or pressure. When pain receptors in the lower back are stimulated, the sensation is transduced into a signal. The pain signal travels from the receptors to nerve fibers. The nerve fibers carry the pain signal through the spinal cord and onto the thalamus, other areas of the limbic system, and the somatosensory cortex in the brain. There are a number of ways in which neurotransmitters can regulate pain signals in the perception of pain. Substance P is a neurotransmitter that increases the intensity of the pain signals going to the brain. Enkephalins and endorphins are neurotransmitters that decrease pain perception by either reducing or blocking the action of substance P. To further explain the important role the brain has in the complex process of pain perception, researchers have proposed a widely accepted theory, the gate control theory of pain. Two kinds of nerve fibers are involved in this process. Small nerve fibers sense pain and open the gate of the pain pathway by sending a signal to the brain. Large nerve fibers respond to normal sensations of touch or pressure. They can inhibit pain signals from reaching the brain, essentially closing the gate. The brain can also send signals that open or close the pain gate. In this way, competing sensory signals can decrease pain. For example, rubbing an injured spot can reduce the feeling of pain by closing the gate. Our state of mind can also decrease pain perception, such as when we are relaxed rather than tense. This is why massage is often a successful form of managing chronic pain.
Once pain has served its function, you want it to stop. But what if pain persists for weeks, months, or even years, as it does for people with chronic pain?
I can only imagine. I had a toothache for a few days, and I could hardly do anything. The pain completely consumed me.
Well, then you've had a brief glimpse into this world, and you have some idea of how important pain management can be. We spoke with someone who experiences chronic pain about what it's like to live with pain that won't go away, and about what they've tried to make it stop.
I have an undifferentiated connective tissue disease. I test positive for lupus, but I'm not full-blown, even though I have those lupus antibodies, and I have Sjogren's syndrome. And I have a double major scoliosis, so I have two 64-degree curves in my spine. I have chronic pain I contend with at different levels every day. Finding treatment that works can be really frustrating because I will find something that will work for a little while and then it ceases to work if I get a new symptom, or just after a while, different medications I'll have to stop because of side effects. So for me, I found the best thing to do was to try everything, to visit every kind of doctor I possibly could, and basically patchwork together what felt like a good treatment for me. Some of that is Western medicine, some of that is what I guess people would consider alternative therapies, and as I said, I do yoga and I meditate specifically to contend with the chronic pain. I find the two of them incredibly helpful.
Based on what we're learning about pain and pain pathways, scientists like Dr. Mary Meager at Texas A&M are developing and testing new therapies to treat people who suffer from chronic pain.
And what is pathological pain?
Well, whenever you have an injury and tissue is damaged, there's a risk of developing a phenomenon known as central sensitization. And that's really what causes pain to persist in individuals and causes the phenomenon known as chronic pain.
How about stress and pain?
Well, that's an interesting area. We've been doing work both in animals and humans on how stress modulates pain perception and how emotional states, whether they're pleasant or unpleasant, how they modulate pain. Once we understand the relationship, you can design pain management interventions to help people put themselves in a much more relaxed state.
Because it would be like stress management to manage your pain.
Right, right. So if emotional states modulate pain, and anxiety, for example, in particular, seems to play an important role, then you would expect that procedures like mindfulness meditation should be able to help people cope more effectively with pain. And there is evidence to support that mindfulness-based strategies that involve Eastern meditative practices seem to help patients with chronic pain. One of the things we found is that pleasant arousing stimuli are more effective than pleasant calming stimuli, for example, which is not what we intuitively believed based upon the clinical literature.
Are there any examples of pleasant arousing stimuli being used to mitigate pain?
Yes, in clinical settings, they're now looking at the impact of having, say, children undergoing, say, skin grafts and other procedures that are painful. Rather than trying to put them in a calm, relaxed state, rather than that, letting them play an engaging, absorbing video game that's much more thrilling and arousing to them. And so you have both attention, affect, arousal going in the same direction to help inhibit pain.